Here is something that should genuinely surprise you. In a clinical trial comparing 3 pain relievers for menstrual cramps, ibuprofen, a prescription anti-inflammatory drug, and ginger, all 3 produce the same level of pain relief. Statistically equivalent, the same result. From a root you can buy at any market for almost nothing. That is not folk wisdom. That is a double-blind randomized controlled trial published in a peer-reviewed medical journal. Ginger has been used medicinally for approximately 5,000 years. Ancient Chinese and Indian medical traditions both documented it as a treatment for nausea, inflammation, digestive trouble, and pain, long before modern pharmacology existed to explain why it worked. What they observed, repeated across generations and continents, turned out to be right. What makes ginger work is not magic, it is chemistry. Specifically a group of bioactive compounds, gingerols, shogaols, and zingerone. These are responsible for the sharp, warm, peppery sensation when you eat raw ginger. That zing is not just flavor, it is pharmacological activity. Fong, you grew up with this. Tell me what your family knew.
Murugan, I have to say, I grew up drinking ginger tea for everything. Stomachache, sore throat, cold, cramps. Basically, any complaint I had was met with a cup of something that smelled like fire. Turns out my family knew what they were doing. Let us start with the most well-documented benefit, nausea. A systematic review examining 12 randomized controlled trials involving 1,278 pregnant women found that ginger was a safe and potentially effective treatment for nausea and vomiting in pregnancy, with no significant risk of side effects. For something affecting between 80 and 90% of pregnant women, that is a meaningful finding. But the anti-nausea effect extends well beyond pregnancy. Motion sickness, post-operative nausea, chemotherapy-induced nausea. Research has shown ginger effective across all of these contexts. The mechanism involves ginger accelerating gastric emptying, the rate at which the stomach moves food into the small intestine, and reducing the signals that trigger the vomiting reflex. That is also why it has traditionally been served alongside raw fish, not just as a palate cleanser, as a digestive accelerant. 5,000 years of practice finally has a biochemical explanation. So Murugan, the inflammation mechanism.
Okay, so here is where it gets genuinely interesting. The bioactive compounds in ginger, the gingerols and shogaols, inhibit 2 specific enzymes called COX-2 and LOX, which sounds like a cartoon villain team, but is actually the mechanism behind most of the anti-inflammatories in your medicine cabinet. These are the same enzymes that over-the-counter anti-inflammatories like ibuprofen target. When these enzymes are inhibited, the production of prostaglandins, the compounds responsible for pain and inflammation, is reduced. Ginger works through a similar biochemical pathway to a class of drugs that billions of people reach for every day, which is exactly why the menstrual pain trial produced the results it did, and why 9 separate randomized controlled trials examining ginger for knee osteoarthritis reported meaningful reductions in pain and improved functional capacity.
Right. And one thing worth understanding clearly about inflammation, because the word is used so loosely, it has almost lost meaning. Acute inflammation around an injury or infection is essential. You need it. The problem is chronic, low-grade systemic inflammation, the kind that smolders quietly in the background, linked to poor diet, chronic stress, and disrupted sleep. This is the inflammation associated with cardiovascular disease, joint degeneration, and cognitive decline. Ginger's bioactive compounds work on these same pathways. It does not cure these conditions, but as a consistent dietary presence, it contributes to an anti-inflammatory environment that supports long-term health. Practically, for nausea, the research supports approximately 1 to 1.5 grams daily, roughly a thumb-sized piece of fresh root, or a well-brewed cup of ginger tea. For menstrual pain, Clinical trials used 750 to 2,000 milligrams across the first 3 to 4 days of the cycle. For muscle soreness, 2 grams daily over consecutive days. And the cautions are real. Ginger has documented blood-thinning properties. Anyone on anticoagulant medication should discuss ginger intake with a doctor before significantly increasing consumption.
If this changed how you think about what is already in your kitchen, share this with someone who has been reaching for the ibuprofen. You never know who needed a cheaper, older answer.
Subscribe. Every week, 2 voices, 1 conversation, something worth a few minutes of your week.
And Fong, do you actually drink ginger tea every day?
Every morning, without fail, since I was 7.
Your grandmother wins.
She always does. Wisdom, reflection, connection.